Hi family, welcome back to my channel. If you are new on the channel, I'm Nurse Josephine. I'm a registered nurse and midwife, and on this channel I talk about nursing, fashion, lifestyle, give health education. I talk about other things other than what I've just mentioned. Today's video is also going to be a feminine talk. It's a ladies chat, so we are still sitting somewhere safe talking about our things, ladies, all things health, but ladies related only. I'm kidding. So if you are a man and you feel like you want to listen to this, you also have a right to just listen to it, and you also have a right to share it, because the informations are very important. You can take this information and make use of it. Family, today's video is going to be about yeast infection. Yeast infection is described as a fungal infection that causes irritation, it causes itches, it causes also discharges, and like I said, itches around your vulva and all that. That is what it is, and it's a fungal infection. So this vaginal yeast infection is also called vaginal candidiasis, and this is a medical term. The word that I'm going to limit as long as I'm presenting on this, because it's causing confusion. I personally do not also know how to pronounce it, even though it's sitting in my profession. It's quite difficult, but mind you, there will be somebody out there that just do not understand, or they will end up getting confused because I'll keep on mentioning this word. So I'm going to avoid it, and instead I'll be using fungal infection or yeast infection. It affects 3 out of 4 women in a lifetime. Most of the women get to experience this vaginal fungal infection. Like, women get 2 episodes per year. Yeast infection or fungal infection, it's not really considered to be a sexual transmitted infection. So if you get to see that you are having or suffering from this, don't blame yourself. Don't feel like you are maybe, no, but I haven't been having sex, I don't have a boyfriend, or I don't have a man. How did I end up having this yeast infection? What do we need to look at when we are looking for symptoms to confirm that we are suffering from, or we are having a vaginal yeast infections? The symptoms are like itching and irritation in the vagina and vulva. You'll be itching so much. I mean, you know, there are times that I know we can confirm this, women, that there are times that you are having that sweet itching. You'll be itching, but it feels so nice. So that is a feeling that you sometimes get, but it goes to a point where you feel like this is not normal. This is not normal. And one thing I like about the vagina is that it will give you a sense of mind, a peace of mind. It will make you to realize that something is not right here, because when the itching starts and it's not normal, I'm telling you, you are not going to like it. Second symptom is a burning sensation, especially during sex or when you are urinating. That's when you pick that you are having that burning sensation. It's, of course, it's not a normal thing. Sometimes, you know, we are used to a good normal sex, so whenever you are having a good sex and whatnot, it's always normal, no pain, nothing. But this time around, you are experiencing a pain that is too abnormal for you. So I'll tell you what to do after. You also experience some redness and swelling on the vulva. Of course, redness and swelling will come up because you'll be itching, and the moment you are itching, you are scratching yourself so much. This scratching will cause now the swelling and the redness of the vulva. Of course, now when you're going to pee, you'll be burning because of the redness that is around there, and the urine has the urea concentrations and all that, so they will burn you, and then it's not gonna sit well with you. As well, talking about the vaginal soreness and vaginal pain and the soreness. Of course, the soreness and the pain will be there because you'll be itching, you'll be scratching, and this is something that I said, you know, it's just not normal already with your vagina. It's not a usual thing, so you know, you are not going to tolerate it, and I don't think you're going to like it. Another symptom is the vaginal rash. When the moment you see that you're having a vaginal rash, just consider that this might be the vaginal yeast infection. Another most common thing is a thick, white, odorless, like it doesn't have a smell, discharges. They'll be coming so thick, and it appears like a cottage cheese, and it's thick, and it doesn't have any smell. I'm talking about the vaginal discharges. There is something that will appear not to be one of the normal thing that you are used to, because the moment you see that, every time you're going to check on your panty liner or your panty, because I'm sure there are people that uses panty liners and there are those that do not use panty liners. So if you don't use a panty liner, your panty is going to have some thick, even yourself when you are just making some movement, of course it's not going to be a normal thing. So another symptom is just watery discharges. it's not normal that our vaginas should have watery discharges. We are not used to this. I don't think it's one of the normal thing. Our normal are clear, jelly like discharges that are not a lot, sometimes not, sometimes, you know, just minor normal vaginal discharges. That is what we are used to. Family, that was it about the mild to moderate symptoms for vaginal yeast infection. So now we are moving to the complicated symptoms of vaginal yeast infection. The moment you see these things that I'm going to talk about, just know that you are suffering from a complicated yeast infection. The complicated signs and symptoms, or the severe signs, are like extensive redness or swelling or itching, like which is too extreme, like something that is extremely bad. So the moment you see those things, just know that you are at a complicated level, because it will also go to an extent, because the moment you are scratching too much or the moment you are itching too much, you're going to scratch, and then it will cause some tears around your vagina or your vulva, and also some cracks, and then some soreness. When there's a sore or when there's any crack, of course you can even see a little bit of a bleeding coming, because that is when you crack, there will be a laceration, and then there will be a bleeding, and of course there is already a crack, and of course it's now extreme. It's not normal anymore. It's not mild or moderate anymore, or I don't want to say normal because it's not normal, but it's not moderate or it's not mild anymore. The second severe or complicated sign is when you have 4 or more episodes of vaginal yeast infection. Some people get to go to like 6 times in a year. This is severe, my sister. It's severe. It's not normal. The moment you see that you are treated with like 4 to 6 episodes in a year, it's complicated. And they are saying also when your immunity is suppressed, like when you're, like for people that are suffering from HIV and AIDS, they are having their immunity are mostly suppressed. So when your immunity is suppressed, you are then at the risk of getting these vaginal yeast infections. Now we are going to talk about the causes of vaginal yeast infection. What is causing vaginal yeast infection? What they are emphasizing here is that we are having our normal mixed balance of yeast that includes candida, and it also includes bacteria. So we are actually having our normal candida in the vagina already, and we have our normal bacteria in the vagina as well. Certain bacteria in the vagina are then there to prevent the overgrowth of the yeast in the vagina. Once the balance is disrupted, there will be an overgrowth of candida in the vagina. So that will now lead to the signs and symptoms of this yeast infection. Here they are talking about the risk factors. The risk factors are things that increases the chances of us getting infected with this vaginal yeast infection. So these things include now, number 1 is the antibiotic use. Most of the ladies love antibiotic. I don't know, but not only ladies, I know also men loves antibiotic, but they are then not at the risk of getting this vaginal yeast infection. But yeah, you'll find someone that will just request that they want to be given antibiotic. No, I've been having a chest pain, please give me antibiotic. My back is paining, I need an antibiotic. So antibiotics are not good for us ladies. So they are saying here the overuse of antibiotic, because there are some antibiotics are having a broad speculum. They are broad speculum antibiotics, and they are the ones that are responsible for killing our normal bacteria that lives in the vagina. So the moment then they are killed, the balance is disrupted in the vagina. So there will be then an overgrowth of candida. They are then at the risk of getting the vaginal yeast infection. They are also saying the increase in estrogen level. Increase in estrogen level in our body mostly can be caused by the hormonal family planning that we take. For example, Neuristrate, the injection, can also cause the increase in the estrogen level in the body, and then it suppresses the progesterone. The moment that the estrogen hormone increase, to also then put you at the risk of getting the vaginal yeast infection. It also happens, the estrogen levels are also high in women that are pregnant, because when you are pregnant, the estrogen, the progesterone level is get to be suppressed, and then the estrogen increases. The moment you have that, then you are still at the risk of getting the vaginal yeast infection. Then they are also talking about the women that are living with HIV and AIDS, or women that are living with condition that suppresses their immunity, suffering also at high risk of getting this vaginal yeast infection. I'm sure some people who ask questions down here, like what will I use, because contraceptive, what we have different types of contraceptives. So we have hormonal ones and those that are not hormonal. People that are on contraceptives and they experience hormonal contraceptive and they experience this, you have good options to change from the hormonal contraceptive to non-hormonal ones. We have IUD, it's also not hormonal. I think I've spoken about some contraceptives in my previous video. It's just that I did not emphasize on the, I think mostly on the hormonal ones and non-hormonal ones, but I've spoken about it. But if you still want to hear more about the contraceptives, you also just comment down below and tell me to talk more about them again, and then you have a good choice to pick of whichever you would want to take. Ladies, how do we prevent ourselves from, or how do we reduce the risk of us getting or suffering from this vaginal yeast infection? They are saying use the underwears that have cotton crotch and they are not too tight. Let's try to put on, because sometimes, I don't know, there are people that believes that a panty should be tight, it should pull the booty. No, it shouldn't be that. You don't want to, because the moment you want to pull it, the moment you want to make it too tight, it will also then tighten the thing, and the thing is going to be suffocated closer, and this is not what we want. They are saying try to get a cotton crotch, and then you also make sure your panty is not tight. One secret that I do is I reduce the chances of me putting on a panty in a day, like in a daytime, not in a daytime, but for as long as I'm home. What I normally do is I don't put on a panty when I'm home. I don't put on a panty when I'm home. I don't put on a panty when I'm sleeping. So that the chances of me having a panty on is reduced. So I only wait when I'm going out. This is something that I do. I know also, if you also do the same thing, comment down below and tell me if you do the same thing and what are the benefits of, how do you see it, because I'm personally enjoying it. I can like spend the whole entire day home, you see, dressing nicely, but under there I don't have a panty. It irritates me a lot. So I also choose to have panty that are having a cotton lined in between here. It's a cotton crotch material, but they are also not tight. I take the loosened ones. I take the material that is a bit that allows my vagina to breathe as well, and it also just doesn't hold my booty, and I don't like my booty shouldn't also be tightened up. I don't like it. I don't even enjoy it anymore. They're saying you should avoid douching, because douching is yes, it's good, but the possibility is there that it kills the normal bacteria, the normal vaginal bacteria, because we are having, like I said earlier, I've said we are having normal vaginal bacteria. So now the moment you start to do douching, it can possibly kill this normal bacteria in the vagina, and then it will increase the risk of the overgrowth of the candida, and then you are exposed to the vaginal yeast infection. The products that we should be using shouldn't have any smell, guys. We don't have, the pads, the tampons, any feminine product that you are putting down there. You make sure it does not have any smell, because the moment it has that smell, it's going to put us at the risk of acquiring this vaginal yeast infection. They're also emphasizing on the hot tub. I don't know how, but if you have a knowledge on what could be, because of course, I think the environment, the vaginal environment is quite already good and normal for the vagina, that I don't think when we put heat, it's going to be okay. Of course, those are membranes. How do you feel when you put a hot tea in the mouth, or just that smoke in the mouth? Because I think the mouth environment cannot even be compared to the environment, the vaginal environment, because I think we try too much. We are trying too much with things that are not supposed to be done. Let's just try to avoid also on this steaming. I know a lot of people do steam down there. Some are using hot water to wash down there. They are saying it's putting us at the risk of acquiring vaginal yeast infections. So also unnecessary use of antibiotics. I have make an emphasis on that. I have emphasized on the use of antibiotic. We should reuse. Let's not be doctors ourselves. Let's not already go to the hospitals knowing what we want, because reasons doctors are not giving you antibiotics because they know that it's not necessary, and they know, they understand the risk of getting antibiotics. Sometimes I know, like I remember getting an antibiotic one time and I just started itching. I started itching down my vagina and I was like, I think I'm stopping this. I'll be itching. I got a probiotic, but I was itching, so I just decided, like, dog, I'm gonna stop this. I'm not taking it again because it was really bad. I was itching like, no, I don't understand. Itching. Imagine that itch. You can't even be amongst people. You are itching. So I literally picked that this was the problem, and I know the antibiotic that I got is one of the broad speculum antibiotics, so I totally stopped it. I don't want to make wrong emphasis on the experience of vaginal yeast infection, but if you once suffered from a vaginal yeast infection, just come down below, tell us how was your experience, because I personally did not suffer from that. The only experience I got was the antibiotic that I took, and then I started to be itching, and then the moment I stopped, it also just stopped. But I applied, when I told the doctor gave me a cream to apply down there, and I also got some vaginal pessary that I inserted in. It's a tablet, like a vaginal suppository, a tablet that you insert in the vagina. So once I got those ones, I got fine. I didn't have any discharge, but he was like, it's more or less like I'm getting a vaginal yeast infection because of the antibiotic. So I literally stopped the antibiotic. I didn't get the much experience really of the white thick discharges and all that. I don't know how bad the experience is to have those things. But if you suffered, like, guys, I said, if you suffer from that, please just comment down below, tell me how it was. But if you see yourself having these problems, what do we do? Go to the hospital. Of course, don't be home because you are not going to manage it yourself. There is something to be done. Doctors are going to give you medications. Also, if you go to the health center, they know what to give. There are guidelines that are giving guidance on what to do, especially when it comes to this type of infections. So you go to the hospital. If you don't have a private doctor, I keep on emphasizing this. If you don't have a private doctor, go to your private nurse. If you don't have a private nurse, go to the community clinic. Go to anywhere where there is a health center. You are going to be assisted. Please, this was it about today's video. So if you have any question or any comment, if you want me to talk about any type of condition, please just comment down below. Let me know, and also give me a thumbs up, comment, like, share, subscribe. Stay tuned for the next video. I love you.